Hi, today I will discuss something about childhood asthma. About 300 million people in the world are asthmatic, and 10% of our population of our children are suffering from asthma. Now, what is asthma? Asthma is a disease of airways where our airways become hyperactive, hypersensitive to some kind of allergens. Not everybody will react in the same way as a person who's predisposed or genetically predisposed to have asthma. There are certain triggers which precipitate the flare or the episode of asthma. So these triggers can be many. They can be indoor, they can be outdoor. In outdoor, we know these days pollution plays a major role in development and in presentation of asthma in young children. And there can be smoke, there can be pollutants, there can be smog. These are the outdoor pollutants. The indoor pollutants are house dust mite, the smoke, the cockroaches, pets and danders. There are so many things. And in Indian scenario, the havan, whenever there is a havan, so many times children come to me ki there was a havan or a puja in our house, and following that my child is coughing incessantly. And during Diwali, the patakas, the crackers, which pollute the environment. So every time after Diwali, we have a lot of children coming with an attack of asthma. So, and the cockroaches are actually universal, and it has been studied to be the major cause of asthma these days. Then dampness in the walls in the house, and house dust mite. Now, house dust mite can be present in the cleanest of clean homes. It is there in the carpets, in the drapes, in the tapestries. So we have to take care of all these things properly. Now, what happens in asthma is once the inflammation is triggered, once the episode is triggered, the airway becomes red, it becomes swollen, it becomes edematous, and there are secretions in it. So the child tries to cough, but because the airway becomes narrowed because of the secretions, because of the swelling, and because of the muscular contraction, the child tries to cough out, but the cough doesn't come out, and there is an expiratory wheeze, something like this. So this all happens, and the child should be taken to the doctor, and if the doctor hears a wheeze, then he or she prescribes a certain therapy to the child. Now, once an asthmatic it is said that it is always asthmatic. You can control asthma. So how do we control? The most important drug to control asthma is inhaled corticosteroids. Now, there are so many myths associated with the drugs that we give for asthma. For example, the older people say that these drugs, inhalation knocks up. How can I give inhalation to my small child? My grandmother took it for so many years and eventually she died. I don't want to subject my child to any inhalation. Can you not give some syrup? I'm even ready for some injections, but don't give inhalation. So my humble request to all those parents is that when we give inhalation therapy, we give smallest amount of effective drug. When we give a drug through syrups or through pills, the child swallows the drug, and then it gets absorbed into the circulation. It goes to every other part of the body and also to the lungs, and we do not want the effect of that drug in any other part of the body except in the lungs. Whereas when we give the inhalers, the drug goes directly to where we want to give the drug. So inhalers, by giving inhalers, say a quick relief inhaler of salbutamol also. There are many syrups in the market which contain salbutamol, but these syrups contain 2 milligram of salbutamol per 5 ml. Whereas if we give 2 puffs of salbutamol through spacer and mask or spacer alone, we are giving drug in micrograms. So this way it is 1000 times less than what we give through oral drug. So it is very important for us to understand that the only therapy that we give for asthma is through inhalers. There are some quick relief inhalers that is given only for a short period, but the main important drug is inhaled corticosteroid. And if these inhaled corticosteroids are given in a proper dose with a regular follow-up, it causes absolutely no harm. There have been many studies to show that in the adequate doses or in small doses, these inhaled corticosteroids, even given for a year, do not cause any harm. So always follow the doctor's advice and always try to understand that asthma is a clinical diagnosis. In asthma, the child may have cough, may have incessant cough, may have nighttime cough, or the child may cough during running, during laughing, or during playing, or any viral cough gets prolonged. These are all symptoms. So asthma is generally a clinical diagnosis, but we should try to confirm the diagnosis by getting the pulmonary function test. Nowadays, pulmonary function tests can be done even in as young as 2-year-old children, but we generally do a pulmonary function test from 6 years onwards, and it's a very correct method to know whether your child's airways are narrowed or not. And even on regular follow up, the pulmonary function tests are very necessary. So in nutshell, asthma is extremely common, most underdiagnosed and most undertreated ailment of childhood.